Oh. So we're releasing it on the way up and on the way back, just to help the muscle slide a little better. Hey guys, Dr. Will here from Miami Spine and Performance here in Hallandale Beach. Today I want to take you guys through kind of what a full body adjustment looks like. We have some specific areas we're going to work on with Scott, but before I adjust anybody, I do my palpation and I look for those specific areas of the spine that may not be moving as well as they should, okay? So with Scott here, I'm going to start, check the neck. I know Scott tends to get a little bit tight here up in the neck, so that's something that we'll address a little bit later. Just trying to hit that. Down here, check the lower neck. This is an area that tends to get really stiff with guys that are sitting, working on the laptop a lot. I know Scott's working super hard, so you get a little bit of stiffness that builds up through here. Check the upper back. Just looking for springiness, looking for areas that might need a little adjustment. Found something here, T17. I'm gonna come down and check the lower back, check the hips. I already know from working with Scott for a little while that his hips tend to get a little tight and locked up, especially if he's traveling or if he's working a lot. So that's usually an area that we'll adjust as well. Confirm. All right, I'm gonna have you go ahead and lie on your back, please. We're gonna start. Now, typically when we do adjustments on people's upper back, we're looking to get more extension. In Scott's case, he actually has a bit of a more flat back, so we're actually going to adjust him into a little bit of flexion. Come up here. Oh, nice. All right, I'm going to have you roll on your right side, please. So once I get Scott on his side, kind of set up for the adjustment, I'll kind of recheck what I found before, just to kind of confirm where I want to adjust. There's this arm. You doing okay here? Perfect. Deep breath in. Nice. I'm going to have you flip to the other side. Same thing here. Adjust the sacrum, so that's the tailbone. Just keep your bottom forward a little. Lying back forward. So one of the things that I do at my office as well is I'm always checking feet and adjusting feet. I think it's one of the areas that gets neglected a little bit, but obviously, you know, when we're walking around and things like that, our body's kind of absorbing compression through the feet. So if the feet are stiff and they're not doing their job, that can lead to, you know, knee issues, hip issues, lower back issues. So it's super important to make sure that the feet are nice and mobile. You can see here Scott's got a pretty good motion down at the ankle. Then it gets a little stiff there through the midfoot, so we'll do a quick adjustment there. Now that's moving a little bit better. And same thing here, Scott moves pretty well actually through this foot. Maybe just a little higher. So again, that's just going to allow him to use his foot a little bit better, so ultimately that'll take less pressure off the rest of the body. Always check kind of wrists and elbows, especially a guy that's typing a lot. This wrist feels pretty good. Sometimes the little bones of the wrist can get a little bit out of place, so just do light little adjusting here in the wrist, just kind of make sure everything's nice and set. All the nerves of the upper body kind of come through here into the hand, so it's really important that the wrist is moving well, so you can use your hands. other side. You're ready, you're ready. Yeah, so the left one's actually a little more jammed up here. Feel that a little bit? Yeah. So in addition to doing our adjustments, we're also going to do some soft tissue work to help open up the muscles of his hip, allow him to move a little bit better. Scott's also going to be traveling soon, so we want to make sure that he feels great for his long flight and his hips don't lock up on him. So the first thing I'm going to have you do, Scott, is lie on your left side for me, and then you're going to scoot back towards me. So one of the most stubborn muscles for people that are sitting a lot, or if they're on, in the car a lot, long flights, is the psoas, or the hip flexor muscle, right? So if we're seated, we're kind of in this closed position. So then when it's time to open the hip, this gets really tight. So one of the things I'll do is I'll go in and kind of release this muscle here. My soft tissue of choice is active release technique. So it's going to be me performing the muscle work, but the patient's also going to be moving. So it's kind of like an exercise and soft tissue all in one. So first, to find the muscle, I'm going to have you take a breath in, Scott. Push your knee up. One more breath in. Okay, so what I'm going to have you do, Scott, is you're going to extend this knee and then slowly bring that leg back. So on this next rep, once your leg's extended, go ahead and reach that top arm on that. Okay, got it. Extend straight back. Reach overhead. Nice. There's one more pass here. Same thing with the arm. Okay, so after this hip flexor, we're going to work on the lateral hip here. This muscle, the TFL, tends to get jammed up, and that'll cause a lot of that IT band tightness. Everybody's always trying to foam roll and get rid of that tightness here. So a lot of times the issue actually comes from this muscle up here. So what I'm going to have you do for this one, Scott, is you're going to start here, and you're going to drop. Got it. Okay. Just relax this leg for a minute. You can incorporate the arm in this one too.
Okay,
just
gotcha.
jump it up.
Good. Can you incorporate the arm after the leg is down?
Yeah.
Okay,
Yeah.
got it.
Oh, nice. Oh yeah. Last one. So again, we'll kind of do some rechecks. Always auditing, making sure that we're having good therapeutic effect here with our soft tissue work. So after we've worked the TFL, we're going to move back here. And we're going to work on the glute, kind of the piriformis area. Again, a lot of sitting kind of causes some issues in this area. You have that sciatic nerve, the famous sciatica, right? A lot of times it gets stuck here on the glute and it causes some of those symptoms down the leg, so it's important to open that up as well. So I'm going to have you scoot this way, Scott. Still facing that way. So now for this one, I'm going to have you just bring your knee up and kind of hug it to your chest.
Got it. Incorporate the arm or no?
No arm on this one.
Got it.
So we're releasing it on the way up and on the way back, just to help the muscle slide a little better. Nice. Okay, last one. bring the leg off, contact the muscle I want to treat, and have them just bend the knee. Good. Add pressure. Good. And really we'll just work all the way up and down this muscle, finding those tight areas. This spot's a little bit tight through here. Side here, kind of get into where the hamstring and quads come together. Tight. Breathe here. Just hang out in this stretch to keep your breath. That spot right there. So we're between the IT band and the middle quad here. They're a little stuck together, so we're just going to keep a little pressure, oscillate a little bit, try to peel those muscles apart, get some blood flow in there. All right, guys, so that's what a typical treatment on a hip with ART is going to look like. Again, we're kind of getting in and we're treating globally, so we're treating all the muscles around the hip, all the issues that might be going on. It's a great complement to adjusting, so if you're looking for good adjustments and manual therapy, Dr. Will, Miami Spine and Performance in Hallandale Beach.